it did do to us and the changes that have affected our lives since then, good and bad. And we're hoping to educate you through this so that we can move forward with a common purpose to bring more awareness and education and research and action into Canada so that this treatment would be available to anyone who seeks it. Tonight we are privileged to have with us Dr. Bill Code, who's going to be giving us a little bit of a medical introduction to the concept of CCSVI. For those of you that may not be aware of it, the ins and outs, the speakers, we feel like we've gone to school and had a quick indoctrination into our own anatomy and everything medical. So we'll be using a lot of the terms that Dr. Code will introduce to you, and they've been flipping by on the PowerPoint as we go tonight. So hopefully you've been doing your homework. Dr. Code is not only an anesthesiologist, but he was diagnosed in MS and became very much into the holistic practice in the management of MS. And it's a natural complement for him now to be speaking to us about CCSVI and its potential to open up new avenues of exploration for therapy for this illness. So thank you very much, and I welcome Dr. Code.
Thanks very much, Sandra. Can you hear me okay at the back? Works? Okay, good. Anyway, it's good to be back in Victoria. I came with my mom all the way over the Malahat because we live in Duncan. And it used to really surprise people that we'd come all the way over the Malahat just for a meeting, right? And then I'd say, well, and then we're going to go home after over the Malahat. But the Malahat's a lot better than it was 30 years ago. So it's a pleasure to be back in Victoria. I want to compliment Sandra for putting this evening together because there's much happening here and there across the country. And I think this is the first significant event of this kind. There was one in Calgary a couple of months ago, informational based, but you know, this is the first one on the West Coast that I'm aware of, and it's great to see you folks out. We're not going to, spend a lot of time with that. I wanted to outline one thing. I'm sure you know what the MD means. The FRCPC that I have is the same as the one that your neurologist has, okay? It's a fellow of the Royal College of Physicians of Canada, all right? So I've got the same length of training. In fact, I spent 2 years studying the brain on the bench, your bench research, in addition in Calgary. And in Calgary, where I started training in 1983, it was the first place in Canada. At that time, they were just starting to do it. There was one cardiologist who was out in the forefront, Dr. Merle Knudsen and David Roth, also with them, and they were spending 4, 6, and 8 hours with people with coronary angioplasty. And all the people that did coronary artery bypass graft surgery said they were nuts. It would never be anything. But within a few short years, it became almost a standard of practice, and you can't talk to anybody in their 50s, 60s, 70s, or 80s that hasn't had chest pain and perhaps 1, 2, or 3 stents. Okay? So stents, and the angioplasty that you do in the coronary artery is a lot of ways parallel to what is talked about opening up veins. As you know, arteries take blood from the heart and then to the tissue. Veins, of course, are the reverse. They pick up blood at the tissue and take it back to the heart. That's important for a couple of reasons, all right? It's particularly important because it makes a difference to the flow pattern, and it makes a difference also to the issue of stents, all right? And that's why, it's talked about in that format. So let's just back up a little bit from there, but I wanted to make that statement out front because this is not as scary as some of us have suggested to you that it is, perhaps. Multiple sclerosis, an autoimmune illness. This is not suggesting that any of that has changed. It has been known for 150 years that there was always a vein at the middle of the plaque in multiple sclerosis, okay? So the veins have been somehow involved in this. And there's a number of times it's been suggested that that should be followed up and investigated. Several things have happened, and then, of course, Dr. Zamboni in Italy spent 25, 30 years studying veins. Now, veins, you learn in medical school, are very unimportant. Now, there could be an exception on that if you had nasty varicose veins, as both my parents had surgery for and my older sister. And so it makes me wonder, well, maybe my sister with MS and I also have a problem with our veins, but maybe not the lower half, maybe the upper half. So we don't know yet. All right? So if the veins are blocked, the concern is, of course, that there's some back pressure of blood to the brain, and therefore there is an extra buildup of pressure of blood and the deposition of red blood cells or iron. Most of you will know that if you get iron into the tissues of the body, it's quite irritating. If you get blood into a joint, you have major pain and inflammation happening to that joint. Well, the same suggestion is it may be the trigger, one of the triggers, to start that so-called cascade of inflammation and autoimmune disease. Okay? We are not saying that there is not an autoimmune component to MS when you're talking about CCSVI. It stands for chronic, more than 3 months. That's the definition usually in medicine. Cerebral, up here in the brain area. Spinal, because of course that's the other part afflicted with MS, both the brain and the spinal cord. Cerebral, spinal, venous insufficiency, meaning that there is not enough blood being drained away from the tissue. Okay? So it's a plumbing back pressure principle that is suggested. And of course, as most of you know, what I usually talk about is the journey with multiple sclerosis, because we all have a different, slightly, journey. We don't fit in the same box. 70% of us get headaches, 70% of us get muscle spasm, 70% of us get cognitive problems, 85% of us get fatigue problems, but I've met a few people that don't have fatigue problems, okay? So it's a different journey for each of us. It's also probably the solutions are a puzzle. And some of us will have pieces of the puzzle that work, that don't work for others. And I would suggest that look at CCSVI as a piece of the puzzle. It might be a very large part for you or for me, or it may not be. One of my friends recently was very disappointed. She was in Mexico and she did not have any blockage to her veins. Okay, so that piece of the puzzle isn't going to work for her. So that's sort of where the principle goes on. And there's several places, of course, studying that venous issue throughout Canada and the United States. It's being embarked on by UBC and the University of Saskatchewan, and there's a bit happening down east as well. There's a lot more happening, I think, in New York State, in Buffalo and Albany. Stanford backed out of it, or the fellow had to. I think they will go back online, but Stanford case is worth bringing up because people may or may not have heard about it. There was a fellow in Stanford very keen to do it. It was in the early CTV report, one of the people that were done at Stanford, right? So the consequences of what happened at Stanford, the stent in one patient came out, okay? So it travels to the heart. In anesthesiology, we put a big tube into that internal jugular vein a lot of the time. We put it in whenever we do a heart bypass, and we put it in whenever we do an abdominal aortic aneurysm or in the intensive care unit, all right? Because the jugular vein, in many cases, is a straight pipe into the heart. And of course, the other thing that happens in veins, if you remember or think about it, they get bigger as they get closer to the heart. So that's the tricky part about the stent. It's almost brain dead to put a stent into a coronary artery because they get smaller and smaller and smaller. So what's the likelihood that the stent's going to disappear downstream where the blood flows? Almost none, because it's a smaller and smaller pipe. But it is more tricky to put it in the vein. And that's why, to this point, Dr. Zamboni, the fellow in Italy who originally described the whole concept, has suggested we should ideally wait until we have stents that will stay better or are more designed for the vein side, because they're getting bigger. Having said that, I'm sure we'll hear tonight there's probably someone on the panel up here with a stent in place. Because if I was sitting there on the operating room table, they've dilated maybe 2-3 times my jugular vein, say it's blocked, but it collapses as soon as they, take the balloon away, then I would be willing to consider a stent personally, okay? It's a decision that would need to be made at the time, so people need to think about it. So that's the issue about the stent. Now, the other thing that happened in the Stanford protocol, they had one of their people was treated, and their routine there was to put people on blood thinners in a major way for 6 months after. One unfortunate person happened to have a brain aneurysm burst. Now, unfortunately, when you have a brain aneurysm burst, this is when there's a young person on the football field or a young woman that's pregnant. We don't know when these will burst. Almost always when they burst, we have an unhappy outcome. But of course, they said, well, it's because she was on blood thinner. Well, your chances of getting to the hospital in the right time is even less, of course, if you're on a blood thinner. Most people do not survive those burst aneurysms anyway. But it was enough to have the neurology side of the people at Stanford shut down the program. Okay, so that's what happened. Otherwise, Stanford would be helping move this forward because there was a couple very keen there. Now, who is usually doing the procedure? Usually in Canada or in the United States, it's done not by a cardiologist. They tend to focus on vessels related to the heart primarily and somewhat the chest, all right? However, the ones to the brain and the neck are done by interventional radiologists. So these are radiologists with an extra year or 2 years of training, putting in small catheters up into the brain to open up a blocked area because maybe it's the carotid or another artery supplying and preventing a stroke from happening again. It's the same as preventing a heart attack, except it's in the brain tissues, and it's done by interventional radiologists, okay? So it's useful to know sort of the roadmap and the playing field, and then you can start to maybe understand the dynamics of interaction. So I think that pretty much takes us, I'm just going to refer you briefly to the diagram because you're going to hear some of these tonight. You'll see at the bottom of the diagram where there's that fork or Y, upside down Y, that's the external iliac. So that's the vessel as it goes through the groin. If you feel into your groin, you can feel that artery pulsing. Okay? Well, it is. All right, and right beside it, well, yeah, we're a mixed company. Maybe you won't do it here. But right beside the artery, it's very revolutionary. In medical school, they taught you they're always together. Nerve, artery, vein, and they are, pretty much. Okay? So the external iliac goes up, and now we're into the area called the so-called inferior vena cava, which is the big, big vein that drains the lower part of the body. And as you go up, then you get to the upper major vein, which is the superior vena cava, which branches off into the subclavian and then the jugulars. The internal jugular, left and right, typically right beside the carotid. You can feel your carotid pulse. That's the one you check in the gym to see your pulse. All right? You don't want to check them both at the same time because then you'll faint sometimes because the blood needs to get to the brain. But right beside is the internal jugular vein, and then there's usually an external jugular vein draining areas around the neck and head as well. But typically the brain is primarily drained by the internal jugular vein. Now, we all have variable arteries within us, but the arteries are much more consistent than the veins. Veins are extremely variable among us. Probably in the forming process, they took the path of least resistance. It's a bit like the roads on Vancouver Island. They built the logging road where it was easy to drive. It's the same when the veins are being formed when you're in utero and starting to have these veins created. It takes the path of least resistance, and the likelihood of having identical veins between any one of us is almost nil, all right? But there's small variations, and there's general groups to it. And that's an important piece. Now, the azygous vein is a little more tricky. It's represented by the two tiny, almost railroad track things on the edges. And the azygos vein sits right in front of the spinal column, so in front of the bones. All right? As such, it's a very hard, virtually impossible place to look at with Doppler or ultrasound. The others, you know, the jugular veins, and even now the newer Dopplers, the so-called transcranial or veins inside the brain and head, inside the skull box, are readily assessed by ultrasound. The azygos vein is almost impossible to assess unless you put dye into it. You've all heard of the concept of injecting dye, taking an X-ray, and seeing what happens, which is exactly how they started doing coronary assessment years and years and years ago. All right? So that's an important differentiation in the two, and it is possible now in some centers to infer, by looking at the transcranial veins, to infer what's happening in the azygos vein. But classically, to see if there's any issue, you need to look at the dye. So I think that's a summary. Anything? Yeah. So I think that will give you a baseline of what's happening, because some of you have had a chance to see the pictures and others haven't. But now, hopefully, we're all and I'm also very keen to hear the rest of our presenters. So I look forward to that.
Thank you very much. And Dr. Code has agreed that if at the end of the session when we do question and answer, if there is a question that one of the panelists can't answer, he has agreed to be our medical person on the spot, and so we're really appreciative of him staying around for that as well. We're going to go down the table now, and please, we're going to start with India and then move through Poland to Mexico and finish off in the United States. So we're doing a little bit of around the world here as we go through the panelists and where we've been treated. I would ask that you save your questions for the individual panelists until the end, and we're going to try to save as much time to the end as possible. So if you have a question for an individual panelist, write it on the palm of your hand or in a scrapbook, and then when we open up for Q&As, we'll be wandering with the mics, and you can ask your question to the panelists that you wish to, or just throw it open in general and say, did any of you ever hear your doctor say X? And so with that, I'm going to introduce our first panelist. It's Sylvia. I'm not going to try her last name. And Sylvia is here to tell us about her treatment experiences in India. So take it away, Sylvia.
Okay. My name is Silvia Runategi, and then after I got so tired of MS and I was sitting and sleeping all day long in my bed, I said there is something wrong with me. So I said, okay, I started to investigate, and I said, well, I will go to Italy. No, a long waiting list there, 2 years. And then I said, no, I will go to Poland. A long waiting list again, 1 year. And finally I found India. And then I said, can I talk to the doctor? And the doctor said, yes, I am. I said, okay, do you speak English? And he said, yes, I speak English. Okay, I am in Frankfurt, so I will arrive there. Amazing. Then he said, okay, Sylvia, if you come, I will operate you. I said, okay, where did you get your degree? He said, in Johns Hopkins. I said, well, okay, you will get my operation. Then I show up in India, and I was able to see him, and then of course I met a lot of people. But at the same time, I used a person, her name is Jasmine, and she was excellent. She programmed everything for me, and I was in the best hotel that you can imagine. So one day I said, what a nice weather, so I will go out, and went out because it was sunny. And then I started to sweat, and I said, how hot is this? No, we're only 53. I said, 53? Yeah, we always make it to 58. I said, forget it. So I went in again to my hotel, and I said, this is crazy. And then I talked to Jasmine, that is the person that planned everything for me. So I said, this is awful. I cannot even go out to eat. Then she said, go to the floor 18. So I went to the floor 18 and I said, here I am, I come from Canada and I am starving. And they said, okay, do you want to have breakfast? I said, yeah, whatever. And then she said, okay. And then the waiter came with a big lobster. I said, oh, this is free? Yeah, that was free. I said, okay, I will come back tomorrow. And then I started to go every day. And then one day she said, Sylvia, you don't want to eat Indian food. I said, no, too much curry. She said, no, I will prepare for you Canadian food. I said, okay, perfect. And then after that, of course, I went through the doctor, and the doctor started to do a lot of tests, MRI, X-rays, everything, until 2 days. And then after 2 days, he said, you are ready for the surgery. I said, what kind of surgery will I have? He said, well, I don't know, Sylvia. So I went to the surgery and I said, okay. So they put something here and they went all the way to my heart, no problem. Then they went to my neck and then 2 red lights. And I said, what is that? Am I dying? They said, no, you have a blockage in your vein. I said, really? Yeah, and you have another blockage in the next vein. I said, really? And then he said, we can dilate it for you. I said, okay, disappear that. And then he said, okay. And then I said, ooh, it's really painful. He said, no, Sylvia, you are feeling because we are disappearing the blockage. I said, okay. So I said, how long is this surgery lasting? He said 2 hours and a half. I said, but you told me it was going to be only 1 hour. He said, Sylvia, we didn't know what kind of blockage you have. Okay. And then he said, okay, we clean your 2 veins. I said, well, wonderful. And then he said, Sylvia, after this, we want you to come 4 times. And then they send me every day a taxi from the hospital to check me and to check me and to check me. And I was improving and improving and improving. It was amazing. So I said, oh, every day was better and better and better. When I was not even able to walk or to do anything, I was able to talk and to do everything. So it was amazing, really, it was amazing. And then the doctor said to me, Sylvia, after 3 months you will improve. The 3 months are not over because I have this in June the 10th, sorry. So the 3 months will be in September the 10th. So I'm hoping that I will recover. But anything that I want to tell you guys, if you want to go to India, please go. Because it was just like a honeymoon, excellent hotel, and excellent doctors, and excellent everything. The only thing is they all believe that they speak English, but you don't understand any of them. It was terrible. It was terrible. But it was a very nice experience. And then when I came back from India, the first day that I said I will have the surgery, I stopped injecting myself betaseron, that I've been injecting myself for 15 years, and I left it cold turkey. So I said to my neurologist, that is Stanley Hashimoto in Vancouver, he said, Sylvia, nobody leaves it cold turkey. I said, nobody, but you don't know me. So I left it cold turkey, and I am very well. It's amazing, very, very well.
Thank you, Sylvia. And our next presenter is Betty Notar. And Betty has some PowerPoints. And are you just going to signal Landon when you want to change the slides there, Betty?
Sure, that sounds
Okay.
great. So I'm going to talk to you about my experience in Katowice, Poland, 4 weeks ago. And for those of you who know me personally, know that I tend to be quite a private person. So for me to talk publicly, especially about my health, is a bit of departure. But it was so helpful for me to talk to real people who had gone through the experience in my decision-making process that I am more than happy to share my experience. So, slide, thanks. So first of all, I was diagnosed with MS in 2004. I've been treated as if it's secondary progressive. Sort of minor symptoms that started to worsen in the last couple of years, primarily fatigue, drop foot in my left leg, some mobility challenges. Have not taken any of the MS medication, have followed basically a more holistic complementary approach, paid attention to my diet, tried to do lots of yoga, nutritional supplements, regular massage, that kind of thing. So when I heard about CCSVI, very interested, did lots of research, like I'm sure many of you have here, and decided not to go to False Creek to get sort of private testing. First of all, it was $2,500, and that test would not be applied to any treatment here in Canada. And it was a 6-month waiting list. And I figured if I'm going to go for treatment, they're going to want to redo the tests anyway. So I thought I'm not going to do that. The neurologist I see is the head of the MS clinic at the UBC hospital. She said, don't waste your money, it's all a fad, and didn't offer me anything else. So I thought, well, my GP was supportive and said to me, if I was in your shoes, I would do the same thing you're doing. So that felt very supportive. So I checked out a whole range of clinics, put money down in Scotland, checked out Poland, couldn't get calls returned from Albany. But the Poland Eurometa Clinic, I gave them my name on March 23rd, so I was on their waiting list, and was impressed with their research that they do. They trained and studied closely with Dr. Zamboni, followed protocols according to Stanford, and I'd heard about them on CBC, watched the two brothers from Winnipeg, talked to Ginger McQueen from Calgary who went, so I had sort of a bit of a contact with them. So anyways, on June 1st, this is the clinic of Katowice. It's basically Soviet-style architecture. It's pretty bleak. It's a clinic that is rented by a private group. There's a very well-trained group of physicians, cardiologists, vascular surgeons, a neurologist on their team, a whole range of internal medical specialists. So I was impressed with their team. So on June 1st, next slide please, I got an email. My first response in March told me it'll be sometime in 2011, so, long waiting list. But June 1st of this year, I got an email from Katowice saying, are you still interested? It's going to cost 6,900 euros, it's about 9,000 Canadian, and it's going to happen sometime in July or August, so just a heads up. So 3 days later, I got another email saying it's confirmed, it's July 12th, and please confirm with us within 3 weeks and send us a full amount of the money. So I, again, scrambled around and talked to some other people that had gone and decided to take the leap. You do get reimbursement if you don't have, I didn't get stints at the end of the day, so I will get 500 euros or $700 reimbursed. And if you end up going over there and they find no blockages, you get about 75% of your money back. So off we went to Poland, my partner Nance and I. At the end of the day, this is expensive. The treatment was the equivalent of 9,000 Canadian. Airfares in peak season of summer, and we decided to go a little early to get over jet lag and stay later in beautiful Krakow. So altogether, I figured it's about 17,000 Canadian that we've spent, which I intend to claim as a medical expense on my federal income tax next year, since this procedure is not available in Canada. So July 12th, I have some notes here so I can follow along so I don't have to look. July 12th was the big day. There were 6 of us. They do 6 people a day, 6 days a week. 70% of their patients come from Canada, I found out. The rest come from Europe. In my group of 6, you bond pretty intimately with folks. There were 2 other Canadians, 2 from Great Britain, and a young lieutenant from the Dutch Army who was there. It was quite a trip. So July 12th, we had an eye exam to see what kind of inflammation was going on. That's for their research purposes. Then we had an MRI of neck and blood vessels following their Stanford protocol. A couple of people in my group had had prior testing. They'd paid for it privately. They'd had false negatives, so they had been tested elsewhere and told no blockages, and they showed up in Poland and went through all their diagnostic tests with Dr. Marian Simka and found out they did in fact have blockages. So I had a collar Doppler ultrasound with Dr. Simka. And then the venogram, which is the insertion of the dye, which is the most definitive test. And sure enough, both jugular veins very blocked. I had gone sort of fearing that if I had angioplasty that my veins would close in. So I went wanting stents, but I was there on the operating table arguing with my vascular surgeon. Gotcha. And he said, nope, you don't need stents, your veins are fine. So I had angioplasty on both sides. The treatment, oh yeah, this was on the wall of the clinic. You don't see this in many Canadian hospitals. Anyways, next slide. The treatment took 25 minutes for me. For others, it took longer, again, through the femoral vein. I spent 1 night in a hospital, 7 nights of heparin shots after that. The doctors all spoke English. None of the nurses did. The neurologist that I met with, that's me just going into it, next day, I met with the neurologist, and he said, and I put his quotes in here, it's part of the MS puzzle. This can halt progression. Improvements happen within 6 months. Not helpful for neurologists to take the stand that they're taking around the world. And there's lots we don't know about the venous system. So since I've come back, it's 4 weeks. I've got a lot more energy. My fatigue is almost gone. My body temperature is more even. I don't have headaches anymore. And I think there's some improvement with my drop foot. So you have to do a lot of research and check things out yourself, really find out about people's training, find out what the costs were. In Poland, it included 5 nights at a hotel and all the diagnostic testing and follow-up. I did sort of a homeopathic detox before I went. I paid attention to my nutritional supplements in case there were contraindications with blood thinners, so things like ginkgo biloba you want to stop a week before you go, that kind of thing. And I really relied on my support network, which I nurtured and valued and really appreciated. And the last thing I want to say is, there's a group of us that have a class action human rights claim. CCSVI is recognized in 47 countries except Canada, and we feel that it's a discrimination that we are denied this. So for anybody who's interested in participating or learning more, Gwen Morrison is the contact, and here's her email. So thank you very much, and I'm happy to provide any information anybody wants about Katowice, Poland. It was a good experience, and I'd recommend it, especially in summer.
Thank you very much, Betty. And next on our list from Poland is Valerie McNeil.
Hi, everyone. I'm Valerie McNeil, and I was diagnosed with MS 2 years ago in June 2008. My symptoms started up in about January 2008, numbness in my hands. Things were getting worse and worse to the point in June when I was diagnosed. I haven't worked since June 2008. That was a huge loss in my life because I had worked in my dream job as a counselor for just a year after I graduated and had to say goodbye to that. And as most of you know who can't work as a result of your MS, you have reduced income, significant reduced income. But the reason why I couldn't work is I suffered from very profound fatigue. So basically for the last 2 years, I lived on my couch. If I could struggle downstairs every day, I would. To go to a doctor's appointment would be a big production. I'd have to shower and get everything lined up the night before because doing everything that same day was often just too much for me. And then the next day, I'd be really extra fatigued. So it really took its toll on me. In June 2010, June 27th, 2010, I was liberated in Tychy, Poland, a different clinic than Betty. I was part of a study. Dr. Kostecki was my surgeon. I did a lot of research, a lot of talking to people on Facebook. I was researching since I found out about this in November 2009. I had a supportive GP. I'm one of the lucky ones. I know most people don't have that. So I talked to him. as with Betty, I was kind of debating the fact whether I should go to False Creek and get tested. And someone very close to me in my life who knows what I'm like said, well, what if you get the Doppler and they don't find anything? I said, well, then I'll pay for an MRI. Well, what if you get that and they don't show anything? And I said, I'm still on that plane to Poland. So I'm very determined. And in fact, when I had my angio, or my Doppler, ultrasound, and the MRV, in Poland, they didn't show much at all. In fact, they after my Doppler, they kept asking me, are you sure you have MS? Are you sure you've been diagnosed? You don't have Lyme disease, you don't have anything else? And I said, no, I have a positive diagnosis here. You know, my heart fell. I traveled all this way, and I thought, they're not gonna, it's almost like you want them to find something bad. But then I went back to the hotel. There were 10 of us having it done that weekend, and most of them had the same results. So, you know, I've heard before that venography is the gold standard, and in my experience with the people I went with, that was definitely the case. During my surgery, both sides were blocked, and I had an angioplasty on my left jugular. And during the surgery, the right jugular would not stay open. So on the table, the surgeon came to me and said they recommended a stent and asked my permission if I would allow them to put a stent in. And I said, absolutely. I came to Poland for a reason, and I was almost happy I was receiving a stent. It seems like weird thinking, but I'm sure a lot of you can understand that. And they went into my azygos vein, and they said it was very narrow. They recommended getting tested again in a few years, but the blood flow was okay. So I'm really glad I went. I had to take heparin shots for 14 days and was very bruised after that. I also have to take 150 milligrams of coated aspirin for the rest of my life, and I'm on Plavix for a year. So there's a lot of cautions that go along with that. I have to be very careful of bumps and bruises. If I'm in an accident of any sort, even if I'm not injured on the outside, I have to go to emergency because I could risk bleeding internally. I know these things, but the quality of my life before makes it worth it. And I think everybody individually has to balance that out. And I put a lot of thought into it, and I was prepared for the risks. And I know that I'm not cured. I still have MS symptoms. I still have MS. But one of the main reasons that moved me to go is I have an 11-year-old daughter. And for the past 2 years, I've missed out on her recitals in school, any days parents go to school to take part in activities. You know, I aim to go, but I just can't get up those stairs to get dressed and get ready. And she's been a trooper, but she's missed out on a lot in the last few years, and she'd always say, it's okay, Mommy, I understand, but when you're 11, that's pretty hard to deal with. And I thought, if I can get the chance of being a more active mom and doing those things that I love to do with her, it's worth it, even if I get a bit of energy back. So I didn't feel anything the day of my surgery. Nothing much the next day. I rested the whole day in the hotel. And then on the second day after surgery, as the afternoon progressed, my energy was going up and up and up, like I had been given shots of caffeine or something like that. And it just continued to increase, which was a huge gift for me. We went and toured Krakow for a week after, and I'll just share with you, we were walking in 30-degree weather. I couldn't handle heat at all. I stayed in on hot days. I couldn't walk, maybe a block on a good day, and it was a 2.5-hour walking tour, and halfway through I stopped myself and I thought, I can't believe I'm doing this. I can't do this. And I felt great after the tour. So that's when I knew, you know, I'm more stable. My energy is increased. I have increased strength. I'm doing more and more in the swimming pool. My brain fog, I won't say it's gone because I need to cling to something for excuses. But also, I just want to get across to people there's no guarantees. In the last few weeks, my energy has gone downhill significantly. It's not nearly how bad it was. And I was also told by the surgeons that be patient. It takes up to a year. So I'm experiencing little changes, and my walking is improved. I was looking at a year at a wheelchair in the very near future, and my walking is perfect now. So yeah, I'm happy to talk to anyone about Tihi Poland and my experience, and I just thank you all for being brave enough to be here and finding out about this whole procedure. Thank you.
Thanks very much, Valerie. So now let's swing into Central America, or is it still, is Mexico Central? Central America. No? Anyway, BJ is our next patient telling about his experiences getting treated in Mexico. Push it up. Oh, I know.
I take that back. Hello. Hi, is everyone hearing this? It's going through, good. I guess I'm too far back. You'll have to forgive me. Last time I faced this many people sitting down in front of a table like this, I believe I was an altar boy in a very big, large Catholic church in northern BC where I was born and raised. To my credit, the church was round, so therefore I don't think I could be cornered by the parishioners, and certainly the devil didn't have a prayer. But yeah, I went to Cabo San Lucas, Mexico to receive my CCSVI treatment, and I landed in Cabo about 7 o'clock on I believe it was a Thursday night, and I was in the clinic, what is that clinic called, Bob? Amerimed, thank you. Bob obviously went to the same clinic as I did in Cabo San Lucas. However, he went there about I think a couple months prior to when I got there, which is a good thing. Can you imagine a couple of Canadian MSers in Cabo San Lucas loose for a week? Lord help them. But I landed at the clinic the next day, and I was there pretty much the whole day. Of course, starting right off the gate with meeting neurologists, doing a bunch of tests, obviously, blood work and everything else. The MRI, I believe I had the MRI, not the MRI-V, but I had the ultrasound Doppler, and that's where it was discovered. As the gentleman was doing the ultrasound Doppler on my neck area, when he got to my right jugular vein, he kind of said, "Oh boy, Dr. McGill is going to have a whole lot of fun with this one." And I sort of looked at him and said, "What are you talking about?" And he said, "Well," he said, "it's very restricted, about 90% restricted." And I said, "Well, you know, how bad is that based on what you've seen?" He said, "Well, based on all the ones that he'd seen up to that point, I was definitely in the top 10% worst ones that he's seen." So it was pretty bad, in other words. The left one was about 35% restriction, and other than those two, I had no other restrictions in my veins. So basically, later that day, we went into they call it the cath room, where they did their duty, and all went well. And I was in there for probably, by the time the dust settled from my first time going into the cath room, I was in there probably for about 3 hours, and everything was going well. And they spent a lot of time with the right jugular vein, and the tech who did the Doppler obviously didn't lie when he said Dr. Miguel will have a lot of fun with this one. And we tried 3 or 4 times with different sizes of balloons and all the rest of it, and every time he removed the balloon, and it just collapsed and just was not staying open. So at the end of the day, I basically met with the surgeon, Dr. Miguel, and we had a chat, and he basically said, you've got some options here. First off, he said, the left one all went well. It's open, flowing great, the left jugular vein. He said, the right one, however, just no way is it staying open, and we're having a real difficult time with this. So your options are A, we put a stent in there, or B, we do surgery, which you're traveling into pretty muddy waters when you get into surgery on jugular veins up in that area. Or he said, we can do nothing. And I said, oh, well, if we do nothing, I might as well just stay in Canada, right? But, so anyways, that led me to another date a couple days later after a gentleman flew in from Guadalajara, Mexico, the mainland, with some supplies, my stent being one of them, along with other supplies for the clinic. And so a couple of days later, I found myself back into the cath room, the surgery room at the hospital, and we proceeded to tackle after I might add, the World Cup soccer game, which they had to put it off till after that. But so they put the stent into my right jugular vein, and all went well. It opened it up, flowing was great, and that procedure probably took no more than a couple of hours. And that was it for my surgery, and I basically recovered a little bit in the hospital for maybe a half hour until my brother showed up, and off we went back to our resort, which was really quite nice, I might say. I'd love to go back under different circumstances with perhaps a brunette instead of my brother, but we'll see what the future holds on that one. But yeah, so where was I? Who needs a cast of Seinfeld when you got me, right? Wait till I hand it over to Bob. But yeah, and it was like everyone else has said, a bit of a costly procedure, but you can't take it to your grave, and God help if you get cremated. So yeah. I am feeling wonderful as always, unfortunately. Well, that is fortunately, I should say, but I've never ever suffered with any conditions of fatigue or brain fog, no pain issues. So my biggest issue is that I'm the only one at this table in a power chair, essentially, so that's my biggest problem. I'm just physically not real mobile. I do lots of exercise. I'm really big, as Betty had said, on nutritional supplements. I have not done any hard-hitting drugs, i.e. the ABC drugs. Otherwise, I guess I'm a reasonably healthy guy. It's just, I feel great, no pain, just can't get up and dance. But, again, as Valerie indicated, this could take, as she said, up to a year. I was told, you might be going as long as 5 to 6 months before you get any kind of significant improvements. The biggest improvement I got right off the hop was when they put this stent in my right jugular vein. I felt like I just took about a 500 milligram hit of B3 niacin, so my body felt like it was on fire, which is a good thing. So you've got the circulation going, and yeah, and my swelling in my feet have really subsided. I used to have fairly swollen feet, kind of puffy, swollen almost, and that certainly has been an immediate thing that I've witnessed. But, I'm waiting to see what the future is going to bring me. So thank you very much, and I'll turn it over to Bob, and he can...
Thank you very much, BJ. And his Mexican counterpart here is Bob. Don't call me Robert.
That's right, and don't forget that. But my name is Robert Fraser. I was as part of one of 10 people in Los Cabos, Mexico, doing the clinical trial for the CCSVI under the tutelage of Dr. Rafael Moguel. It was a fantastic trip. I can't begin to tell you. It was the care and compassion which we felt by the staff there was immeasurable. Before I went, I'm 50 years old, single. Available. And I was diagnosed in 2008 with PPMS, or primary progressive MS. For some of the people who know me, and I know that there's a few here, they saw my rapidly decline before my venture. I was very lucky to have obtained this clinical trial. I still can't believe it at times. And the amount that I've felt since then, and since my return to Canada, my treatment was on June 14th, has been almost like a rebirth. I was diagnosed when I was 49, and I feel like I've been reborn at 50. It has really been utterly profound. Part of what the benefits which I've received so far is that my balance is vastly improved. As a matter of fact, I'm able to ride my bike again. I hadn't been able to ride it in a couple of years. My speech has improved. My vision has improved. As you'll see, I'm not wearing my glasses to look at you. I still need them to read. You can still send me dirty notes and I won't know what you're saying. I have no more headaches. Those are completely gone. I have no more pain in the right side of my neck. That is completely gone. My feet are no longer cold. They are warm again. They haven't been warm like that in years. And no, when I say cold feet, no, that was a bit of a shock when you're lying in bed there and you accidentally touch yourself. Like, oh, my feet are cold. Now, I'll put that to you again. I'm single, so you don't have to worry about the cold feet in bed. Okay. I had it was an almost 80% constriction in my right jugular, which was causing the pain in the neck there, which I had. And I have not had to have any stents. I was angioplasty all the way through. There were other constrictions, but not as bad. The benefits which I've gotten, like as I said, have been profound. And through my research in this post my event has been that anyone who has had the treatment, no matter how severe their MS, have all received some sort of benefit. Even if it's just warm feet, it's a benefit. Now, the one thing which I want to stress, and I really mean this, I'm quite sincere, is that no matter what you read in the newspapers or on the internet in particular, CCSVI is not a cure for MS. It was never stated to be a cure. Dr. Zamboni, when he popped out with this, had said it is not a cure, it requires further study. And it's a brand new avenue, it's an open door. So please don't be thinking that, oh, well, great, I'll go and have an angioplasty and I'll be walking and running and so on and so forth, because you won't. Or you may not be. You may, actually you might be, but you might not be. The other thing, and with that goes as well, what your expectations are. If you go for treatment, and I really encourage you to, if you can, if you go, don't go with a list of expectations about things which you can do, because you might only be disappointing yourself. You have to look at fulfilling yourself and the abilities that you foresee that you are going to get better in some respect. Now, if anything, of all the research which I've done, no one has gotten worse. Not all of them have gotten radically better, but no one has gotten worse. Primary progressive, which is the topic which I have, is listed out. If you look at a scale, it just gets worse. So, in 2 years, I would probably be like BJ. What this treatment did for me was that it just proved that textbook a lie, because it turned me around. So that's something that which the textbook said could never happen, but it did. Well, I guess stubbornness goes a little way. Anyway, Los Cabos was a fantastic place to visit. I am going back in February for a checkup. I've since had an online checkup by the neurologist there. And we keep in tabs of what my progress is and how it's going. So, without any further ado, I'm going to pass you on to Sandra, and she's going to talk you through. And remember, I'm single.
Thank you, Robert. Bob. I'm bringing it back home to North America. I guess I was, well, maybe not in terms of nautical miles the closest to Victoria, because I went all the way to Albany, New York to be treated. And I had the privilege of having July 7th, 2010 as my second birthday. And I was diagnosed in 1992, but I've really had symptoms for approximately 31 years. I am on the cusp of secondary progressive, being relapsing remitting all my life, or I will say it, all my life. And next slide, please, Landon. The first thing I did is I did go to False Creek and have an MRV and a Doppler on March 2nd, and my experience there was a slam dunk. 4 different doctors looked at my Doppler and my MRV, and they all told me I had a significant stenosis on the left-hand side. So I had no doubts that I had problems. But, I agree totally with everyone on the panel, because only at the point of venogram do you really find out what your problems are. And I'll tell you what, how my diagnosis differed, the one that I got through the Doppler and the MRV, and what they found on the table. So that's a picture of me on the inside. So next slide, please. This is the diagnosis that was done by the 4th doctor, which is Dr. Hakey. You may have heard of him. He's at the forefront of MRI and MS imaging. He took a look at the scans that were done at False Creek, and he did what's called a flow quantification report. And he showed me that my left jugular vein at one point in my neck was almost non-existent. On the little gray square there in the bottom left, actually on the right-hand side of that gray square, that little yellow, Landon's pointing to it, the yellow circle, that's supposed to be exactly the same as the right one, which kind of looks like a large black dot. The black is the blood flowing through it. As you know, when you lie down, your jugular veins are in full production and emptying your brain. Well, my left jugular vein faded off to absolutely nothing at that point. And you can see the flow quantification report on the lower. The amount of blood going through my left jugular vein was significantly less, being the bottom right red line, significantly less than what was flowing through my right. And again, this is when I'm lying down and things should be flowing full force out of my brain. Okay, next slide. This is the diagnosis that was done at the point of venogram. And on the left-hand side is kind of what the body looks like in a normal X-ray. And this shows you the guide wire that is up through your veins all the way up into your left jugular vein. And it's hilarious. They go in through this little insertion point. I'm not going to show it. On the left. And the next thing you know, they say to you, well, Sandra, we're in your left jugular vein. And you go, oh, okay, you're fully awake for this. It's just a wonderful experience. And then he shoots some radioactive dye out of the little end of this catheter. And if you notice, the dye just bounces off something and goes back towards the heart. It's not going up. It's supposed to shoot upwards in a straight line towards the brain. A little bit of it leaks through, but most of it just clouds back and bounces right back towards the heart. There's obviously something stopping that blood from going up towards the brain, which, you know, by inference then is something is also stopping the blood getting down from the brain. So, next slide, please. He puts the balloon in and he inflates it, and if you can see in the lower right-hand slide there, the balloon would not inflate across whatever was blocking my vein there. It's like a balloon animal in my vein. You know, the vein had an obstruction in it so great that the balloon could not inflate. And so he forced it, pumped it right up, and tested the flow again. He was not happy with the flow, and he ended up having to balloon it again to get rid of that obstruction. It turned out the obstruction was actually part of my vein wall, wasn't separated from the other side, so I actually had like a membrane or a part of the vein wall that was occluding the vein opening, and so no wonder my jugular vein didn't work so well. But if you did read the MRV from False Creek, you'll notice that the obstruction noted by False Creek and Dr. Hakey was much higher than what is being ballooned here in Albany. And the doctors in Albany came to the conclusion, and this is now becoming best practice with angioplasty, that when they treat downstream problems closer to the heart in the jugular vein, often the upper problems correct. And this is indeed what happened when he ballooned me twice, and you see the fully inflated balloon there in the lower left. When he ballooned me twice, they checked my blood flow again, and my jugular vein, that blockage that was higher up, no longer existed. So it's almost like, you know, they untangled the bit of vein at the bottom, and that sort of self-corrected the vein all the way up. And it also, just as a cautionary note, it keeps them from putting that guide wire right up close to your brain, because my blockage that was shown on the first slide was very close to my brain. So he said, look, we treat the downstream, we stay in the jugular vein, we don't go up near the brain, and you stay safe. Okay, next slide, please, honey. Oh, that's my husband. And I'm married. So, and this, I wanted to show this also to Dr. Code, his points that he made in the beginning about the azagus. These are scans of the azagus vein. My jugular veins each had to be ballooned twice. Then they moved into the azagus, and they found 5 stenoses, I guess, in my azagus vein. This is one of them, and you'll see the ballooning there on the right-hand side. This is the balloon, again, trying to inflate across the stenosis. The balloon will not inflate. There's something there blocking it. So they just pump that little sausage up, and they get it nice and fully inflated, and they get rid of the blockage in the azagus. They did that 5 times in me, so I had 9 different balloons inflated. The ones in the azagus, they hurt. It's kind of down between your heart and your right breast. And it hurts. And but you know, if you've ever had a mammogram, ladies, it's not worse than that. So next slide. Men, you'll just have to wait and see. These are the results. I have improved balance, improved stamina. My husband wonders that I stand and I don't look for a chair all the time to sit down. My leg spasms, which were a constant problem for the last 3 or 4 years, have 99% disappeared. I haven't actually had a spasm in the last 4 weeks and 2 days. I've had what I call hint of spasms. It's like, oh, I might be getting a leg spasm, and I just stretch my leg, never materializes. So I would call those 99% gone, and I was on drugs for those, lots of physio, lots of acupuncture, and they've gone. And my swallowing is 100% improved. I'm gaining weight. I'm eating everything in sight. I no longer have dysphagia, and I can swallow handfuls of pills now, whereas before I had problems swallowing a single vitamin D. And the other day I started typing with 10 fingers. I was having a bad day with dropped foot. I'm going, why is my leg dropping all of a sudden? And then, oops, shut that off. And then all of a sudden, my fingers started typing. So I was talking to Valerie earlier. Sometimes when we get low and we feel like, I feel like I'm getting symptoms coming back that were disappearing, all of a sudden something else got better. And I'm now typing with 10 fingers again, and I can't tell you how exciting it is to all of a sudden see that your body's doing something that hasn't been doing for so many years. Anyway, that's it for our presentation part. We're going to leave it now for a full hour, hopefully, of questions and answers. And so what I ask you to do is there'll be people floating around with microphones. So put your hand up, and they will acknowledge you and then get to you with a microphone. Direct your question either generally to the panel, or if you can remember our names, or just yell out a country. And we will do our best to answer any and all questions. And we'll just take it from there, and thank you very much. All right, and please wait until you get the microphone before you ask. And so who's got the microphone now? Okay, go ahead, please.
Hi, Sandra.
Hi.
I wanted to know how long you had to wait to go for surgery in Albany and how much it cost.
Oh, I'm sorry. Yes, I phoned May the 10th, and so I waited 2 months. Their lineup has considerably increased. You're looking at first quarter 2011 now at the minimum if you phone today. My total bill was $5,000. And you don't pay that. You pay $3,000 when you arrive at the clinic. That's the venogram part, which they do regardless. And then $2,000 for the angioplasty. So it was a $5,000 bill. American. And I had a question over here. Who's got the mic?
Let's do a couple here, and then we'll work our way across the room.
Oh, okay. Sure. Go ahead.
Hello, I'm asking on behalf of my daughter. You're the only one who mentioned relapsing remitting, and has there been any people who have that type of MS who have been significantly helped? Did you? Thank you very much. Okay.
I was still on Rebif, so I was technically by my neurologist still classed as relapsing remitting, but not anymore because I'm not taking it anymore. Next question.
Okay, this is sort of a question for all of you. And especially white shirt. Where did white shirt go? Oh, there she is. She's in a red shirt now.
Betty. That's Betty.
Okay, hi Betty. You said that we can ask for reimbursement of costs, but from who? Is it the hospital? Is it Canada? Is it only on federal taxes? Is it BC? Who?
Yeah, I mean, the only thing that I think we have a shot at is getting on your income tax, claiming it as a medical expense, so you'd get some back there. But in terms of trying to get anything reimbursed through provincial health insurance, forget it.
Alrighty
at this
then.
point.
Good stuff. Thanks.
That's what the human rights claim is all about, by the way. If we didn't have an MS diagnosis and you found out that you had jugular veins blocked, you know, you may not be denied treatment, but because of the MS diagnosis.
Hi. Regarding the claim to the government, the way I read it is if you are a dependent, then you can claim it. But if you're not classified as a dependent on somebody else, then I don't think you can claim it. At least that's the way I read it.
The way I look at this is that we have a few months to figure out the tax implications, and you better believe the online community is going to be on top of this and look at those sources to try to figure out how to do this. We were actually talking about it earlier. So We don't have the answers yet. I think there's going to be enormous government pressure to allow these claims, and we just need to keep on that so that we can claim this as a medical expense, because the treatment was not available to us in Canada. Okay, next question, and please only ask questions and answer them if you have a microphone, because we are tape recording this.
Bob, can you hear me? What did the cost end up being when you went to Cabo San Lucas? I'm over here.
This is for Bob.
Bob, single Bob, who's desperately...
I was part of the clinical trial, and I won't lie to you, the cost was significantly reduced because of that. But the total cost for the treatment was $1,500. And of course, that had to be pre-approved on, even before you got there, you kind of wanted to make sure you had it. Because it was so last minute, the airfare was almost as much as the treatment was. But does that answer your question?
Do you know what the treatment cost would be?
Yes, right now the cost in Los Cabos is $9,750, and that I know. Excuse me. That includes, I believe, your accommodation, doesn't it?
There's an additional $800 for the MRI. In addition to that, plus you've got your accommodations, obviously, and your flight.
So there you go.
Excuse me. I was just going to say a lot of this information is available online very easily. You just go to Google and Google Cabo San Lucas and CCSVI, and you'll find all that information on there.
I've got a question for anybody or everybody on the panel. Did anybody feel worse for a while before they felt better, or was it instant success? Thank you.
I'll field that question right now. Everyone which was on the clinical trial with me has gotten better. Everyone else which I've spoken to who have had treatment elsewhere they have not had any problems in actually terribly relapsing into the past pain and discomfort. There has been a little bit in some cases, but it's not been substantial. The benefits and continuous upgrades are still there.
I would second that. I was eating pizza in bed, semi-reclined, no swallowing problems. A few hours later, although I did stay in bed the rest of the day, I think you're on a bit of an adrenaline high right after you get treated, and you do feel better just from that alone. Everyone else would agree?
Yes, I wanted to say that I was almost in a wheelchair, and now I'm walking. I couldn't talk, and now I'm walking, talking, and I feel really good. I wake up at 6 o'clock in the morning, I go swimming, I exercise, and it is unbelievable.
Okay.
And Valerie's got something to add.
I just wanted to say, for a couple of days after, I had a slight headache, and I could, it wasn't so much painful, but I could feel where my stent was, and that went away about 2 days after. It was just, I think, my body getting used to it, but like I said, about 2.5 days post-procedure, my energy was just coming back in leaps and bounds, so.
Hi there. I was just wanted to ask the question at the end there. You said you had 9 balloons put in?
They take them out. They
take them out, yes.
Yes. They had to inflate 9 different times, yes.
I was just wondering if there was any extra cost per each balloon.
No, there isn't. It was as many balloons as you need, and so they did it 9 times.
That's good to know. I was just in Mexico, and I had the treatment on July 27th. And for every
Lori, right?
For every extra balloon that they've had to use, it cost me an extra $2,300. That's what they charged me there. So I just think it's really important before anybody goes anywhere, just to make sure that you know all that information before you go. The stent would have been $2,700, but the balloons were $2,300.
Well, thank you very much, Lori, for that information. I know that the balloons do have an individual cost. Do you know that, Dr. Code?
No, they're reasonably expensive to make, and so the pharmaceutical companies that make them, they charge a great deal for them. And they're somewhere in that range of $1,500 to $2,500 because there's different ways to fancify or shape them and different components. And each individual may need some of the unique ones of a different balloon. You can't be certain what you'll end up needing.
Yes, yeah.
I know that other places have remarked that I had an extraordinary number of balloons. I got really good value for my money. And your name's Lori, right?
My name's Kathy.
Oh, you're Kathy. Oh, well, please grab one of our I've Been angioplasty balloons on your way out. And could you please tell us the name of the clinic you went to?
I went through World Club Assist, and I went to Tijuana Angeles Hospital, Angeles in Tijuana, Mexico.
Okay, well, thank you, Kathy. Good advice to when you're getting in a cab in a foreign country and getting angioplasty. Check the price ahead of time.
Okay, thank you.
Thank you.
Hi, this is a question for Bill Code. I wonder, I've Googled a bit. I wanted to know, this treatment is only part of the picture. It's pretty clear that MS seems to only happen in the temperate zones. Vitamin D plays a really big part in it. I also wonder, I've Googled this, I can't find anything. People who have chronic, things, I'm having one of those moments right now. Anemia, like I have thalassemia minor. Does that protect you? Can that protect you somehow? And what is the whole picture with the blood blockage and the temperate zone? And has anybody ever kind of looked at that whole picture?
I'll try and answer your question. I've been in conversation with Dr. Moguel in Mexico, and I sent him an email and I asked him, I said, Doctor, I also sent the same email to Dr. Pedrosa, who's was our neurologist. Neurologist? What the heck did that come from? Neurologist. Yeah,
Neurologist.
Yeah, her. Anyway, I had asked him, I said, in your professional opinion, are there, or is there a possibility of related occurrences with regards to chronic fatigue and fibromyalgia and Parkinson's disease? Now, they mailed me back and said, well, not Parkinson's, because that's more neurological, but the other two, the chronic fatigue and the fibromyalgia, is probably most definitely. However, at this time, there is no known study which is going on to find out whether that is
That's not really my question. My question was more about blood anemia disorders like sickle cell anemia, thalassemia, minor, major, medium, those kind of diseases, and also geography, because we do know that MS occurs only in the temperate zones. The closer you get to the equator, it disappears.
I know that as far as geography goes, I'm going to field that question over to Dr. Code. I've read his books, and I think he can answer that question.
Well, there's a couple of parts to the question. First of all, geography. I mean, we've always talked that it's especially in the temperate zones. And it is to a degree, and I think there is a component to vitamin D. But it's also now hugely common in India and in the Middle East. All right? It has spread around the entire world. There seems to be a subset of people that are relatively resistant genetically, and that would be the Asian people. But I've now met a full-blooded First Nations as well as a full-blooded Chinese person with MS. Okay? It's not exclusive to that. So it's much more pervasive than it was. When I was doing my integrative medicine training in the United States, cardiovascular surgeon from Duke, who grew up in India, was astounded at the frequency it's now diagnosed in India, you know, right along the equator. So it's no longer just the temperate zones. It seems to be much more pervasive. As far as any association with any of the other specialty anemias, none that I'm at all aware of, and read about it a great deal. So I don't think that there is associations within those groups, but it's not exclusive not to have a secondary problem. And of course, if you have one autoimmune disease, such as MS, you are much more likely to have a second autoimmune disease, whether that's low thyroid, you know, Hashimoto's thyroiditis, or whether that's any other variation, or psoriasis, which I have also had a burst of. Okay, so the autoimmune continuity, and that we get more of those all the time, when we have one, we're more prone to have others. But as far as the anemias, and as long as you exclude the issues of folic acid and B12 anemias, which can be concurrent and mimic MS in some ways, then there's no relation that I'm aware of.
Okay, the next question, Braden, who have we got?
My question is a medical question. I noticed that most of the panel have only been recently diagnosed. I was diagnosed more than 40 years ago. If I have the blockage or the narrowing in my veins, have there been any studies with people who have been diagnosed or have had MS for many, many years, success versus non-success?
No, there have been no studies. I was diagnosed 31 years ago, though. Or I'm not diagnosed. I was diagnosed in 92, so however many years that is. But I've had it for 31 years. So, I think what we're learning is we need to throw the book out on MS. We're talking about CCSVI, and you know, as Dr. Coates said, these veins are laid down when we're in our mother's wombs, and we're trying to get them treated now as adults. And so what we're trying to do is say what symptoms that we thought all along might be MS are actually coming out to be treatable with this venous problem. And so, you know, yes, I was diagnosed with MS in 92, but on the other hand, I've had these vein problems all my life. There's been no studies. The studies are very slow in coming, but they are underway.
But have there been any studies about age, as in the older you are, you're less likely to be successful because of some type of, you know, degenerating?
Well, no, I can see very much where you're coming from, and I think we've revolutionized what the brain can recover from in the last decade, okay? If you read, you know, the brain that heals itself or changes itself, there's no reason, no matter what age you are, to give up hope. I think that's totally unreasonable, okay? And people vary. This is, I believe, another piece of the puzzle to give us hope. And I said earlier, it likely won't be an option for every one of us here as far as having blockages, but many of us it may, all right? But there's no reason to go by the number of years of MS. I was diagnosed in 96. I haven't had the procedure, but I'm booked for September 1 and 2 in Buffalo, New York, all right? So I believe it is a worthwhile stone to turn over in your journey with MS. And I am 57 the end of this month.
Okay, the lady in the front is next.
My question is that for the, if you guys have had the procedure, can you be taking, is there anything you're supposed to do to keep the veins open now? And can you be taking iron supplements like that? Or is that anything that you should be avoiding or doing to keep them open?
I had a stent, so I'm on blood thinners for at least a year, Plavix, and coated aspirin, probably for the rest of my life. Does that answer your question?
Yeah, is there a chance that they will get blocked again, that you'll have to have the surgery again?
Absolutely. Regardless of whether I'm on blood thinners or not, there's no guarantee. I have a stent on the right-hand side. I can re-stenose above or below it somewhere else. Yeah, but the people on the panel, we're not medical experts, we're lay people, and we can't really, it's best to do your research and ask a doctor those questions, because we know about our own experience, but yeah.
I know my doctor told me in Albany, he said, go home, try to get used to the new circulation, what it's doing, observe the changes in your body. He said, if you feel yourself slipping backwards after you've had some gains, he said, call me and we'll talk about it over the phone. And he said, and we'll decide whether further diagnostics are in order to find out whether something has happened. But he said, expect it not to be a straight path of improvement. There's going to be setbacks. And so, all of us have said it. You're in for this for the long term. And, nobody can tell at what point do you run and say, I'm re-stenosing. There's that big fear out there. But I look at this like having my teeth cleaned. If I had to do this every couple of years, I'm in.
There's a few inferences we can draw from other times and times gone by. Coronary artery bypass grafting, okay? Typically, 90% of those block within the first year, okay? So they have found so far with working with the jugular veins and the azygous veins, up to half of the jugular veins can block in the first year. The azygous vein, only 5% tend to block. But there's another part to that really matters. First of all, if one gets a window of improvement, you may well continue to have that improvement, even if the other variation of blockage partly happens again, all right? It's a completely unpredictable entity. With angioplasty in the heart, many of those block within the first year, and that's why we put in stents. And then now we're talking about what do we do to prevent it. You heard everybody on the panel ended up with heparin, which is a short-term thing which we use to keep veins open, because once you stretch or irritate a vein, it's more likely to have stickiness of platelets and have a clot occur. And that's what they're preventing with the short-term heparin. If you put in a foreign body, such as a stent, it's an irritant to that vein, and that's why they end up on long-term Plavix and or aspirin, okay? Plavix is usually discontinued at 6 or 12 months, depending on the protocol that's involved. But these are almost all protocols that have been borrowed from coronary angioplasty. And so we're still in our infancy in that regard, as far as finding out. But many of the openings that happen will make a significant difference, and the flow will potentially maintain, and some improvement may occur. We don't know what the opening will do as far as the brain's recovery. You will still need to do your own personal rehab as far as recovery if you've lost a fair bit of that, but it may hugely assist the rate of it.
Okay, next, Shara.
Hello. I wanted to thank you guys, first of all, for sharing all of your experiences, because this is amazing. And then secondly, I was hoping that all of you, Bob sort of touched on the follow-up that he's doing with Cabo, but I was wondering what you guys are doing in terms of follow-up, and also wondered if, Dr. Code, you might be able to speak a little bit to that in terms of what are the opportunities if we do re-stenose and we're back in Canada? Are we going to be ignored by the medical system entirely, or is there an opportunity for treatment there?
Yeah, how about Sylvia? How about you start with what are you being told, and what are your plans to follow up?
Well, the thing is, since I came back from India, I haven't even gone to see my family doctor. But she was very supportive when she knew I was going to go to India. And what did she do? She gave me all the paperwork of all the neurologists and all the people that I've seen. Because at the beginning they said, I have fibromyalgia. And I knew it was not fibromyalgia. So they diagnosed me after 10 years of not knowing what it was. And then after 10 years, I went to all the neurologists that you have in Victoria, all of them, and I was not happy. And then I ended going to Stanley Hashimoto, which is an eminence of multiple sclerosis. And then I went there for 15 years, and they put me in interferon beta, beta-seron, that is very expensive, by the way. It's $3,000 monthly. And I said, okay, and I did it for 15 years. But then when I arrived in India, I said, no more. And I phoned him, and he said, Sylvia, nobody lives in cold turkey. I said, nobody, I do. And I did, and I am doing really well. And
But what about your follow-up on your angioplasty, Sylvia?
Oh, I will go next year to India again to see the same doctor.
Okay, and what about you, Betty?
I'm still wrestling with what I'm going to do. I'm not going to go back to Poland. I mean, Euromedics suggests a 6-month follow-up, and I met people that were coming back for their 6 month. They are teaming up with a hospital in New Jersey, so they're going to open a clinic there in the fall. I may go. I'm not sure what I'm going to do. I may end up at, I know Santa Vive, just south of San Diego, has an excellent program down there. I may choose to go there for some kind of follow-up. I'm not sure.
For the study that I was on in Tychy, Poland, it is recommended that you go back for a 6-month checkup. However, they know that the likelihood of that is not very great, considering most people have come from Canada. If I can at all go in 6 months, I will, but time will have to tell.
And BJ, what about you?
Yeah, likewise, I was told when I was in Cabo they'd like to see me in 6 months as well, so I'm contemplating that. Let me see, mid-January, I don't know. Sounds pretty good.
You can take the brunette.
Well, that's why I'm going back. Yeah, I'll be heading back in February, and as a matter of fact, most who can make it from the original 10 are going back in February as well. We're going to make it a get-together as well, but again, it's under the tutelage of Dr. Mogel. We're going to be retested. I guess probably another Doppler ultrasound and an MRV. Just to see whether or not, or what has, if anything, has reoccurred. But still, we are in email contact, especially for updates, and so no, we're keeping on board with that.
And as for me in Albany, my desire would be to go back to the same clinic and the same doctor. The airport is about a 5-minute taxi ride away from the Albany clinic, so it's something that I could get to quite easily on my own. And I've got lots of air miles from being on Rebiff for 9 years, so I can do that quite easily. But there are clinics opening up closer, and every day it's changing. There are clinics in Seattle opening and all down the western U.S. So, and I know the Albany doctors opened that up to say, look, if you can't come back, call us and we'll refer you to a clinic that's closer and work with their doctors to get you fixed if something happened.
I just got a couple more here, and then I'll come over on that side, okay? So just for you guys here. I got 2 more here, and that's it.
Yeah, I think a final part of the question was, what are going to be our choices here? And I don't think anyone knows that. I've been terribly impressed how fast things have moved forward. This is the power of the internet and Facebook. It has revolutionized the speed with which things have happened, because the paradigm shift really began last September when some of us started to hear about it. I know personally Ashton Embry, who was instrumental in getting the CTV program together and happening, and that was a very big eye-opening piece. We are light years ahead in Canada of the United States of awareness to it. I do a modest number of consultations on the phone to people all across the United States, and most of them have not heard of it at all right? So we are blessed to have had two of our major networks have sort of taken on the concept. It's now a challenging decision for the premiers and the health people across the country. I think it's good that it's a challenging decision for them. This afflicts 4 to 1, women to men. It's typically young people. And it's a huge loss of work capability and or taxes, as well as the other downside of which we all know about. So it's time that they really looked hard at it. You could be doing this for the cost of the system within Canada, probably for under $5,000 to the MSP system, when that is a lot less than a year of beta-seron, as we all know, or any of the other drugs, okay? So we need to hope that they're really seriously thinking and talking about it. The energies that you will present and take away from here will have an impact on that. They are going to listen to the people more so than they're going to, weight change within the medical profession. I had a heated argument with a nurse friend of mine and said, Bill, the physicians will sort this out. And I say, no, they will not. There's a whole different set of power challenges happening there, and it's not going to happen quickly. It will happen much, much quicker in the other system. It took us 25 years to show that coronary bypass grafting made any difference to survival at all. 25 years. And we're still uncertain about angioplasty. But that was a group of older, powerful men with chest pain, and we knew that it took away chest pain, period. Well, if you can take away some of the symptoms of MS, even for a time, then I think it's to be out there. And I am very, very tired of being told we only do evidence-based medicine, because the medicine that we practice in regular Western medicine, and I've been part of it for 30 plus years, is less than 20% evidence-based. So it's a saw that I'm uncomfortable with, and I hope that they will really seriously talk about it. I was hugely impressed when the Premier of Saskatchewan moved forward on it. I'm from Saskatchewan originally, and I know some of you are.
Thank you. Hello, Yasmin.
Hi, I'm Yasmin, and having completed 69 cases of MS, the liberation procedure in India since March, I think I have some statistics that all of you would be very interested in hearing. I want to answer this lady's question first because she is about to leave. We've treated people, not me, the doctors in India have treated people ranging from people that have had MS for 30 or more years, all the way to people that have just had it for 2 years, just been diagnosed for 2 years. And there is no difference between the improvement that people with 30 years of MS see and some of the younger ones see. So it does help everybody, and that's what we've seen. So that's to answer your question. And the question about follow-up, I'm really sad to hear that all of you on the panel actually have to go back to Mexico or to the US for follow-up. But the truth is that you can actually do the follow-up here. What we are doing with our 69 patients is we have a weekly follow-up call with them. That's number one. We're recording all the improvements in the symptoms. Number two, they have to have an ultrasound at 3 months and another one at 6 months and an MRI of the brain at 6 months. The reason for that is the 3-month will show if there is any reocclusion, the 6-month the same reason, and the MRI at the 6-month mark is to see if there is any plaque regression. And the whole idea of this treatment was to see if this will stop the progression of the disease, and that's exactly what we are trying to track. In Alberta, there is a clinic in Calgary, Sunridge Diagnostic Center, and Dr. Barry Steed is very happy to take on Alberta patients under the Alberta Health Program and do the follow-up ultrasound. So all our patients from Alberta are actually automatically booking for a 3-month and 6-month scan with him, and he's doing an excellent job of it. I thought that BC would be difficult, but just this morning I had a call from my patient in Trail, BC. She went to her GP, he ordered an ultrasound, she went in and she came back, she had a stent actually, came back saying that the blood flow was excellent and she was doing really well. So it is possible, and the technique behind that is that if you're in BC and if you're going for a diagnostic ultrasound for MS, doctors are not allowed to prescribe that for you. But if you have already had a procedure and you're actually going up for a follow-up, it's just like a cardiac stent. Like they can't refuse you. They have to do an ultrasound. So please keep that in mind.
Yeah. Hello, my name's Phil. I have a different sort of a question. It's more for the care partners and caregivers. I assume almost all of you had a partner that went with you overseas. And my question is, in each country, how close do they let the care partner or caregiver to the MRI diagnosis? Can they be present? Or where are you when the venoplasty is done? That's my question.
They wouldn't let my husband in. I wanted him to videotape it, and there were 5 medical staff in the room doing my procedure, and they all wore the big lead aprons, and because of the low-dose x-rays, that was the excuse they gave. Landon and my son and my girlfriend stayed just outside the door for an hour and 20 minutes. How about you, Bob?
Sorry, I was waiting. I'm single. And, of course, being single, I, of course, was in there alone, so that I didn't have to worry about anyone wanting to come and take along with me. So, therefore, they didn't have to worry about that.
All right. Anybody else have an issue with getting people in or out?
Where I was, you weren't allowed in. Well, you can't come in for an MRI usually, but they wouldn't let people in for the procedure either. So
the same. My partner was with me with the Doppler ultrasound, but the actual procedure she wasn't able to come in. But you know, they have allowed people in when they've had television cameras there, so it is possible.
All right.
I've heard a question several times about whether or not the stents are MRI compatible. Can anyone answer that question?
Are stents MRI compatible?
my stent is MRI compatible. It's titanium. And my neurologist advised me to find that out before I got it in there. So I think that was very good advice. So it is. I mean, mine is. I don't know about other countries.
Mine is as well.
Yep,
my stent is the same as Valerie's over here. Titanium.
I had no problem going through the airport on my way back.
My other question is for Betty and Dr. Code. Betty, you mentioned that in Poland, which I'm going to, my appointment is September 21st, that they're doing eye exams, and they did send an email to me and say they do an eye exam. I have listened to people on the net talk about their eyes are clearer after they've had this done. My eyes are so red, I look like a zombie. I'm sure they light up in the dark. They're so bad. And we've done several tests to see if there's anything wrong. Nobody can find anything wrong, so I'm assuming it's related to MS, but this is the first time I've heard of any eye exam being done. Can anybody explain why they're doing it or what appears to be the problem with eyes?
I was told they're doing it as part of their research study, so they're tracking to see what's the level of inflammation in the eyes sort of at the point of treatment, and then 6 months later. I just want to let you know that one of the women from Alberta that was treated on the same day I was, one of her symptoms was vision, and she had really, she had a lot of problem with her eyes, and she just emailed me last week to say she's now wearing the glasses that she wore 8 years ago, and she's finding that she's hardly even needing her glasses, so her vision is dramatically improved. But the eye exam took about a half an hour. It was no big deal. And
I'm now reading the white pages in the telephone book without my reading glasses on, and I could barely read them with my reading glasses on before I left.
No, you ask a very good question. It is possible, if you're going to improve blood flow, from the upper body, including especially the head and neck, you may notice that change occurring because it's venous backup congestion possibly. But the reason that they like to look at the eyes so much is it's the only nerve or piece of the brain that you can directly see. All right? So you get a lot of subtle changes that you can notice in the eyes, and if they could get a better way of measuring improvement that they could objectively measure, they would be much more excited with that than they would with our subjective feelings, right? So I think that's probably what they're starting to study toward, because if you can show an objective improvement, now you move light years ahead as far as acceptance with the medical community, because it starts to fit into a mechanism that they can understand, whereas symptoms and feelings aren't as reliable to them. They even disregarded all my symptoms of 15 years because I hadn't seen a physician about them.
Hi, I'm heading to Bulgaria next month, and you mentioned you had stopped, I believe it was Sandra, taking Ginkgo because it was going to cause problems. What would be the best supplements for me to be taking now ahead of the procedure?
I didn't.
Somebody said something about they had to stop Ginkgo.
Betty?
Yeah, I'm sorry, Betty.
I mean, my advice would be for you to consult with your own natural health practitioner. I saw a Chinese physician and a woman who practiced holistic medicine. So it was based on her advice that I stopped all my supplements except for digestive enzymes and probiotics for the week before my treatment.
Okay, I don't have one of those doctors, so if Dr. Code could maybe just tell me if there's anything I really should be avoiding right now.
The longest acting one is aspirin. It's active on the platelet for the life of the platelet, so nearly 2 weeks. So if you're on any aspirin version, stop it 2 weeks ahead of time. The other non-steroidal anti-inflammatory drugs, it's 5 times the half-life, so a week is certainly sufficient. So that would be the ibuprofens and so on. So, those are the big ones, but some of the herbs interact. Ginkgo does. Ginkgo biloba, all right? So if you can't determine it, then you can either see someone in consultation additionally, like myself or whatever, or you can check with your pharmacist of anything you're taking. Many of those are very well studied and understood. Your pharmacist will know because this comes up all the time in their warfarin patients, and there's many, many people on that. So that's the reference point I would go with. Because if it interacts and it's a challenge within the warfarin world, then you better avoid it for that week or two.
I just wanted to know where these clinical trials are coming from. I think it was Bob, the unmarried one, that was talking about clinical trials and how much less expensive it was in Mexico if you were part of the trial. Maybe I'm mistaken, but I'm curious to know where the trials come from. Thank you.
Well, the clinical trial was actually started by Dr. Mogel. He assembled his team, which included the neurologist, radiologist, the MRI technicians, and so on and so forth. He also included, at the end of it, we actually had an interview with a psychologist who was very interested in what happened to us in our perception of having MS to having this treatment and what it has done for us personally. When he did this, assembled the study, all the doctor's staff who were doing it did it free of charge. They didn't charge anything for their time. It was really a very good study. The results were then administered to the Amerimed Hospital, which he was working out of, and then he was able to get the go-ahead there to start undergoing irregular treatments, which started on June the 28th. Does that answer your question, ma'am?
Can somebody maybe talk about what clinical trials are being done, and can anybody be a part of this clinical trial? And I think that's the question that's happening in the room.
Well, I'm sure most of you have heard of clinical trials that are happening. I mean, there's a joint one happening between UBC and University of Saskatchewan. There was one initiated in Stanford, and there's many, many. Typically, before a clinic or a hospital or a university will take on a new procedure for them, they will usually do, you can call it a pilot project, or you can call it a clinical trial. All right? So, and as they're learning to do that particular procedure as a team, usually they will call it a clinical trial, and they will be doing their first set of people at a much reduced cost. All right? Because they are learning with you. All right? Now, it doesn't mean that they don't know what they're doing, but they haven't done it in this series of people, in this series of patterns on the venous side before, in this example. Okay? So being part of a clinical trial, it's a long shot to get in on one, all right, relatively speaking. However, with new places starting up, there will probably be more of those in that regard, but it's a matter of luck and where you're standing at the time, and are you willing to take the potential risk associated with it. The more experience they have, the less clinical trials that particular facility will do, unless they're doing a much bigger clinical trial, as they are in Buffalo, for example. They're doing 500, because they're trying to replicate or study Dr. Zamboni's results. All right? So clinical trials come for any number of reasons, but I think in the Amerimed case, they were validating that they could do this reasonably within their institution, so then they could get the wherewithal and the ability to undertake it in that institution, in that set of hospitals.
Wouldn't it be fair to say that most of these trials are closed? They've already got the people that they want to do in these trials, and so if you're not on a trial now, it's probably very difficult to get on one. That would be my estimation.
Well, there's new trials starting up too, Braden, but okay. I run the Facebook page for UBC MS Clinic, and I'm not affiliated with UBC except I'm a patient there. But a lot of people ask, well, how do I become part of UBC's trial? And the answer was, if you're registered with any MS clinic in BC, you are in the pool to be selected. But as you saw, their demographic for that selection was far narrower, and rightly so. They had to choose a particular demographic for their study. And I would say to people, before they announce their demographic, do you want to be part of a clinical trial? As Dr. Code said, there may be additional elements to it. Secondly, if it's a placebo study, you might not know for 4 years whether you got the actual treatment or a sham treatment, in which case that's 4 years where you might at the end of it. Now, if the treatment is worthy, if the other participants who got the real thing benefit, part of your participation is if you do get the placebo, they offer you the treatment at the end of it. However, you may have to, they want to study MS longitudinally, and a lot of doctors are saying the outcome is 4 to 5 years before they will know the outcome of a clinical trial on angioplasty of this sort. So, if you get the chance to go into a clinical trial, if it's a placebo-controlled trial, what they call a double-blind study or something like that, be aware that you have a 50-50 chance of getting into the placebo group, and are you willing to wait the full 4 years to get treatment? Because the researchers don't want you to cut out at 2 years and go, okay, I'm going to go get my treatment in Poland, see ya. They want you to stay in there for the duration. So being part of a clinical trial may mean you get it for free, but there are costs in terms of your risk to that. Okay, who's got the microphone?
Can I just comment on that quickly? Sure. I was part of a study that's still ongoing in Poland. I did pay for it, but it was significantly cheaper than, let's say, the clinic that Betty went to, which was a private clinic. It is more of a longitudinal study, so they're testing the effects of the treatment, the liberation treatment, and testing the results, and they're following up with us. But you have to have the money to go into the study. It's not just, they don't just select people randomly. Yeah. And none of us were blinded. We all knew, we were getting the procedure, so.
Okay, go ahead. If you have the mic, go ahead.
Just a quick question, and I don't know, I suspect that this is fairly relevant for most people or a substantial amount of people that have MS. Most of you on the panel, do you typically have anemic tendencies? Are you fairly anemic? I just want to know how many of you
I was
actually...
hospitalized for anemia in October with 0 blood iron.
Okay, and...
Stores.
I've always been slightly anemic. I've never had to be hospitalized, but from time to time, you know, I'd get tested and my iron would be getting low, so it's been a factor.
I want to say something. I have always been anemic all the time, and they couldn't do anything, and I was very, very low, to the point that I have to go to an early hysterectomy because my period was so heavy that it was getting worse and worse and worse. And then when I went to the hysterectomy, they took the ovaries and everything. So I said, why did you do that? And the gynecologist said, Sylvia, because your period is so heavy and then you are always anemic, and you have been anemic all your life. So since I got the hysterectomy, I am not anemic anymore. And they said that this is because I went to India and I got the treatment. I don't know if that is the case or not, but the only thing is I'm not anemic anymore.
Good evening. Before you had your procedure done, my question is, did they give you any blood thinners or anything to help out with the procedure? I know that some of you have afterwards been given blood thinners to help out for whatever it is that they have done, but prior to it, is there anything that the rest of us can do to maybe get an edge?
I popped a couple baby aspirin just because I wanted to be a little bit precautious. There's a patient trying to treat herself, but nobody told me to do that. But I did take baby aspirin for a day or two before.
For about 2-3 days before the procedure, we were given Clopidogrel, which is a type of blood thinner, and expected to take 150 milligrams of aspirin a day, and no alcohol. They told us it was forbidden, so.
And no marijuana, I saw.
I am an MS caregiver. My name is Stephen, and my wife Ruth was patient number 17 in Katowice, Poland in December of last year, and that treatment lasted 3 months, and it was a wonderful relief while it lasted, but she restenosed, and I took her back to Bulgaria, and she was treated at the end of May of this year in 2009, so she's actually been liberated twice. And what I learned in that period of time that I'd like to share with you is as follows. And so any of you are thinking of going for treatment, what I suggest that you ask for is a written diagnosis of how you're examined and how you're treated. So you have a written record of it. My wife, left jugular vein was opened in Poland, but they missed the esophagus and the right jugular, and all 3 of the veins were stenosed that they picked up in Bulgaria, and they treated them all. And she's doing fine again. And the big unknown in this whole procedure is how long the veins stay open. The other thing that I learned is that the skill of the surgeon is the essential part of the procedure, and different surgeons have different methodologies, and some are more aggressive than others in the tools they use and the time they spend and how aggressive they are. And then the last part is the esophagus vein. The esophagus vein is one of the key veins, especially for those of you that are in wheelchairs, because that's the blockage that affects your mobility. So be sure that the esophagus vein is properly examined, and there's no proper way of imaging the esophagus vein externally. They make various attempts, and it's expensive, and it's indeterminate whether the results are reliable or not. So only the venogram is the true test for the azygous vein. And we believe
do you have
that
a question for us, though, Stephen? Because we covered the azygous with Dr. Code in the beginning.
Oh, I just wanted to share those things. And one other thing I wanted to say is regarding a negative effect. If any of you have blood conditions, then it's, you should have that checked before you have the treatment, because if you have fast clotting blood, then you could be worse off. And I unfortunately know somebody who's worse off after the treatment than before the treatment, not because of the treatment, but because of the specific blood condition of that person.
I think that's powerful message for getting our primary care physicians involved here in Canada in our total health. Okay, where are we now, Braden, with questions? I see that it's 9 o'clock. I know that I'm going to stay and talk to others, but for those of you that do have to leave at 9, if you've made transportation arrangements, whatever, I will just take a moment to thank you all for coming tonight. And to, if you picked up a bookmark, there's a website which is actually just a little website that we threw together with some of the links that we've talked about. You'll be able to find just our little wisdoms of knowledge, but if, like Braden said, if you're online, you'll be able to find out most of this yourself. There's also contact information for the speakers there if you want to get hold of us. Thank you for the donations towards the cost of this event. We're 6 members of the public. We paid for this ourselves. If there's anything extra in the donation box, our promise is it will go towards CCSVI research. Somebody suggested that we do this again and keep the dialogue going. I know these speakers are committed to that, and you know, anyone who's being treated, please come up and get your red balloon. You have been angioplasty ballooned, and that's what we want to celebrate. And so we want to keep this going, and so let's gather together again. I think look for us to do something new and different next time, but we welcome your ideas. And like we said, there's lots of things that we can do to help spreading this information out in the community so that you can follow us as we move forward in our treatment and welcome more and more onto the angioplasty side as more and more of you get treated. So I'll let those of you that have transportation coming to pick you up make your way out, and thank you for coming. And for those of you that want to stay, we will take your questions and bid the rest good night. Yeah.
I just had a quick question for Dr. Code. Are you involved in any way, or do you know when Canada will get on board with the CCSVI?
What are the doctors saying behind our backs, Dr. Code?
Well, they're extremely hesitant in general, almost across the board, with small subsets looking at different choices. So the best response is from the family physicians to date. And I also believe from the interventional radiologists. The interventional radiologists have agreed internationally that this is a venous issue that should be looked at and considered. And with or without the diagnosis of MS, they're impervious to that. So that will be the group within medicine that moves it forward. But it's a very small group. There's only 85 in Canada. If you put them all busy tomorrow with MS, it would take 10 years to go through the backlog. Okay, so that's a real issue. So, and it's too small a group to have any significant impact. So that's why the bigger push will become when it's validated and paid for within the system. So I'm really hoping that folks work with their MLA and anyone that they can contact, or their member of parliament. As you know, there's already been meetings on it in Ottawa, and I'm hoping that there will be meetings within the province here in BC fairly soon, and of course the premiers are meeting in Winnipeg this week. Or last week, rather. So we didn't hear a lot out of that. They're going to be careful. But if they finally realize that there's a way to save some money, then they might get on board.
I know I met a woman last week, and I told her what I had done and how much it cost me to go get this treatment, and I said, you're a taxpayer. I just saved you $30,000 a year, because I'm now not taking $30,000 worth of drugs a year that used to be paid for by the government. And so she just looked at me and goes, oh my God, we have to do something about this. All right. Who has the microphone now? And like I said, we're happy to take questions, and as the crowd leaves, we'll probably be able to get rid of the microphones. But until that time, who's got the mic? And the rest of you move forward, and you'll be able to hear us if you want to stay for a few more follow-up.